All right, this is a really exciting episode of BDA Baby for me. I am really thrilled to be kind of talking about a much needed space in the whole conversation of before, during, after baby, which is skincare. We've talked about so many different subjects under the umbrella of before, during, and after baby, and skincare is a huge one that people have so many questions about, especially how your skincare routine changes when you're pregnant and kind of what you are dealing with the different kind of skincare routine and just new and interesting issues that you might have after you have a baby. So we are going to be chatting with Dr. Sandra Lee, also known as Dr. Pimple Popper. Here we go.
Hi.
How are you?
I'm fine. How are you? It's so nice to meet you. So exciting to meet you.
I'm
excited to hear you are a popaholic. You and your sister. I love it.
I mean, I was, my husband came into our bedroom last night and I was watching and I was like, do you want to watch? He's like, no, I don't. I was like, okay, fine. Like it's my sister and I send videos of yours back and forth to each other, especially at night, which seems to be a common theme that like people find themselves at night just watching all of your videos. So before we get into everyone's questions and just like pregnancy and postpartum skincare, which is a whole subject matter in itself, I want to just ask you why people are like myself are so obsessed with watching all of your videos.
It was fascinating for me to see this. Like, I didn't know this as a dermatologist. I didn't know that people were so into it, though there was a clue. I think a couple years before I started to post, one of my staff members, one of my my medical assistants, who's lovely, she almost took over when I was starting to remove like a cyst. She was so excited, and then she called her mom after. And I thought, wow, that's weird. And then it came back to me. It came back to me a few years later. I'm like, oh, she's one of us. Like she, but it is just a thing that I think we feel like it relaxes you. It actually makes us happy, which is such a weird thing. It's soothing. It's sort of like putting things back in the places that they're supposed to be, kind of a form of maybe organization or helping relieving these feelings of obsessed OCD a little bit. It's kind of like riding a roller coaster, watching a scary movie. There's like this a little bit of tension and then there's a resolution. So there's also like a happy ending afterward.
I know. So. Yeah. I mean, it's such a wild thing to be really interested in and fascinated by. My brothers think my sister and I are bizarre, that we always are watching your videos. And so just like, no matter how intense the video is, how cringeworthy it is, like it's a strange obsession. And then when you hear another person who's also interested in it, it's like you found another person who's really interested in like a strange thing. So it's such an interesting space. And obviously, yes, you are Dr. Pimple Popper, but you're also a dermatologist and you know so many things about skin and skincare. And we in the space of BDA Baby talk about all things before, during, and after baby. Pregnancy skincare is something I've always talked a lot about because I got really intense melasma. I have friends who got really crazy breakouts. Just your skin changes so much with hormones. So is this a big space for you where people are coming to you asking for help with just things that they never thought that they would be dealing with, but all of a sudden you're pregnant and you're dealing with like all new skin?
Yeah, your skin changes dramatically. And a lot of changes happen that can be permanent and some changes are temporary. Luckily, melasma, which is called cloasma in pregnancy, and for people who may not know what that is, that's like the mask of pregnancy, where you can get the darkening, especially in sun-exposed areas. That goes away for the most part. Some people it persists. But there's so many different things that happen. You can have temporary hair loss. You can have, like stretch marks. Your moles grow, your changes, and it's all having to do with these hormones that that definitely increase, and acne. Sometimes people break out more. Sometimes they break out less. And we all know our skin changes in general, right? Just a lot of changes happen to our body. And it's really an interesting subject. And I think obviously it happens to a lot of women. And so I think that it's something that they need to know about, and because some of these things can be preventable, or at least as best as you can while you're pregnant.
When it comes to like preventable measures that you can take for skincare, I know there are a lot of different subjects. People had so many different questions, whether it's acne, you know, random breakouts in the middle of your pregnancy. A lot of people get breakouts at the beginning of pregnancy when all of a sudden your hormones like go crazy for the first time. And then of course there's melasma, stretch marks. But what are kind of preventative measures that you can be taking? We can talk about breakouts first, because your products are so limited, which is the frustrating part about having all these things happen when you're pregnant for the first time, is that you can't use so many of the things that do work really quickly. You have to be very patient. You have to use different products. So are there kind of tips that you have for people who might be experiencing acne for the first time during pregnancy?
Well, I think one of the things that's really important is to not let it get to you so much, because, you know, realize you're growing this beautiful thing in your body, right? And it has to do with the hormones and everything that is related to growing this human. So I think that is, it kind of can come with the territory with people. But of course it can be really difficult, especially if you have a pretty severe acne. Yes, it limits the kinds of products that we can use on our skin, because we want to protect the baby. And it's a little bit difficult to navigate, because, you know, everybody's a little bit different too, and what kind of products work well for them. But I think it's important, if you do have acne when you are pregnant, to know that you can stick with certain products and see how they work first, like benzoyl peroxide, azelaic acid, salicylic acid, and some antibiotics. Not all antibiotics that we use, that we will prescribe as dermatologists, usually by mouth. It's a little bit complicated, because not all, you know, benzoyl peroxide won't work for everybody.
Right.
So you do want to try these out, but you want to, at least you can kind of do a Google search first, you know, and try to find out what things work best for pregnancy, or what is allowed during pregnancy. But you know, you need to stay away from retinol or retin-A. You need to stay away from tetracycline, which is an oral antibiotic. And so it is a little bit complicated, and it's not so easy for me to explain it, because it kind of depends on the type of acne that you have. But just know, if you get pregnant, you are limited by the type of products that you can use on your skin.
If you had acne pre-baby and you had a history with acne, does that automatically mean that when you're pregnant, you will have more severe acne?
No, it doesn't. In fact, sometimes it clears up. Sometimes it does the opposite, which is really nice.
Yeah.
But in most cases, hormones, and we kind of know this too, because if you're ovulating or right around your period, you're sort of, a lot of us will get like a little pimple breakout. Yeah, that's because of that surge in hormones.
And that also is part of having oily skin. There were a lot of people who asked about oily skin during pregnancy, which actually isn't something that I had even heard of. It makes sense, of course, but is that what is causing people's acne, is just the overproduction of oil in their skin?
Yeah, it gives you that pregnancy glow. You know, a lot of people say, oh,
I was going to ask you about
much better.
Yeah,
because it's like a built-in moisturizer. Your oily skin, I mean, the increased oil in your skin. But yes, increased oil in your skin is also what promotes acne, which is also why we get acne a lot when we're teenagers, you know, because that's where we have a lot of oil, a lot of hormones being produced.
And when you talk about this pregnancy glow, there's so many of my friends who are like, what is this pregnancy glow? I don't feel it. I remember when I was pregnant both times, you know, even though I would stay out of the sun, and I was always really cautious about not going in the sun because of melasma, that I would still just like, I would get melasma here, I would get it on my upper lip, like it would just kind of pop up, and it would fade, you know, postpartum a little bit, and I would, you know, use certain products afterwards. But what is the pregnancy glow, and does everybody have that, or is that specific to people?
I think it has a lot to do with, you know, you're pregnant. You have this way about you a little bit. And so I think it's just a description, you know, people are happy that they're, you know, I mean, I think their skin is just more moisturized in general, because you have more oil production. but like we say, I mean, you know, I didn't necessarily feel like I had a glow. I mean, I had, it was tough to be pregnant. It's, you know, there's a lot of different things that
Yeah.
happen in your body.
Yeah. And there are so many different things that happen, of course, with your skincare routine. You mentioned a couple of things that are safe and some things to stop using, like a retinol. Some people talked about Botox, LED lights. What is something to stop doing when you find out that you're pregnant out of your skincare routine?
Uh, uh, a lot of the, even like medications that you might take, you want to make sure that they're safe in pregnancy. And usually your OBGYN will help you with that.
Hmm.
It, you do a lot of, you know, cosmetic treatments. It's a good idea to stop them. And I think a lot of this has to do, it has a lot to do with just, you know, it's a big deal to have a baby. You want to do everything right. And it's, you know, it causes a lot of
Yeah.
stress to a lot of us. And so you're just trying to be, you know, the most careful that you can be. I mean, you can think about it back in my parents' day, people were, you know, we were doing, you know, we didn't wear seatbelts even in our
Right.
car, right? We get more safe and we get much more careful with the things that we do. So it's just to make sure you have the best outcome that you can. So I don't think I can tell you specifically. I mean, I can tell you things in terms of, you know, if you're on a spironolactone, which is it's a pill for acne that kind of affects your hormones. You need to stop that, or like we say, Retin-A and things like that. It's best to stop those kinds of products. But don't be fearful if you find out that you're pregnant and you're like, oh my goodness, I've been using this topical
Right.
cream and now what's going to happen? I don't think you want to stress about those sorts of things because really it's not, it's just to be on the safe side, you know,
Right.
don't use these products because there is a potential risk, but it's not a guaranteed risk.
And then Botox, obviously stop, right? That's a thing to
Yes.
stop. And then what about people asking about LED red lights?
You know, LED red light, I think, I personally think there's no real risk for that with that.
Hmm.
You know, these are lights that we're getting, you know, out in the environment here. So I
Yeah.
think that really it's more the idea that you want to stop most things just to be careful,
Yeah.
just to be safe here. But an LED light, do I think that it does something really amazing in general? No, not really. I hate to tell you guys that. But I mean, if you're pregnant, I mean, you just want to do all the things you can. I mean, look, we have to like, it's terrible. We can't eat sushi, we can't eat certain kinds
Right.
of fish, and there's all these sort of things that are limited
Yeah.
because we're being extra careful.
Well, there is so much of that now, I feel like from, even 10 years ago of people saying you can't do this, you can't do that. And even now saying like, well, you can at some point have a little bit of wine at some point in
Hmm.
your, like there's a lot of, changing
Right.
information. My mom's always saying this. She's like, even with having a baby and how you care for a baby or a toddler, it's like so many things are changing. So it's interesting with skincare as well about what is changing, what is something to still keep in mind when you're pregnant and even when you're postpartum, because I think a lot of people feel like, okay, as soon as the baby comes out, I can go right back to my normal skincare routine. But there's so much of that that you still have to hold off on even when you're breastfeeding, right?
Yeah, yes. I think we do limit things too because we have certain, you know, we think about in terms of when you're pregnant, what you can use, and also during lactation, what you can use, because some things can be absorbed and put into your bloodstream. So you could potentially transfer them through your breast milk. So, you know, we have little drug books that tell us what if it's deemed safe during pregnancy and deemed safe during lactation. So those are things that we consider as well. I mean, I sometimes will tell my patients will say, "Oh, can I go back on Retin-A? I am breastfeeding," and they're concerned about that. And I usually try to reassure them. I say, as long as you're not putting the Retin-A on your breasts, you know,
Yeah.
like I think you can use it on your face. Just wash your hands well and make sure you keep that away from baby, that kind of thing.
Yeah. No, that makes a lot of sense. Another big question that people were asking about is stretch marks. I feel like everybody kind of goes into pregnancy with this kind of determination of, I'm not going to get stretch marks. I'm going to oil up my whole body every single night and make sure I don't get stretch marks. And then some people wait until they see a stretch mark and say, like, now I'm going to start putting oil all over my body. What is the correct way to prevent stretch marks or take care of stretch marks.
Mhm.
And I've also heard a lot of people say that that's just genetic. Like it's just going to happen to you. If it happened to your mom, it's going to happen to you. So can you give us a little bit of education on the stretch
Right.
marks of it all?
I know stretch marks can be pretty depressing because you feel it's the sense of being out of control, that you can't control your body or
Mhm.
prevent it in ways. So we try to do everything we can to try to prevent it. And I think the best thing to think about in terms of prevention is that it really occurs with quick growing of the skin, quick expansion of the skin. So I don't know if people can really plan this really, but if you sort of maybe more of a gradual, growing of your belly and
Mhm.
things like that. It's not like we can plan these sorts of things, I suppose. But, it is genetic. But it doesn't mean if your mother or your aunt has had stretch marks that you are guaranteed to have stretch marks,
Mhm.
certainly. And you get stretch marks from other reasons. Really, kids, teenagers growing up, when they grow really kind of quickly, that growth
Yeah.
phase, they can get stretch marks as well. And it's difficult to say that you can prevent it with like cocoa butter or oiling your
Right.
skin up. I think it has a lot to do with trying to just like make it more of a steady growth. But I don't know if you can do that really.
Yeah.
Again, I think a lot of people
I
tend to see it like later, right? Like in their third trimester, and all of
totally,
a
yeah.
sudden you wake up and you have these little red little streaks there, and then you get a little bit scared about it and thinking like, oh, can I do something right now to try to prevent this or stop it? But one of the things that we recommend is a topical retin-A or retinoid, and you don't want to use those really during pregnancy. So you're kind of in this little difficult area.
So for someone who's postpartum who, wants help with their stretch marks that they got during a pregnancy, is that something that you recommend waiting until you're done having kids to go and take care of,
Yeah.
or what's the kind of protocol on that?
We do recommend that in general because again, you're pregnant and you're thinking about the baby and the health of the baby as much as you can. And it does seem a little bit like
Right.
frivolous, to be thinking about those things. But it's scary, especially right after you have a baby and then your stretch marks are very
Yeah.
red and they're more noticeable than newer stretch marks. So that is the time that we do recommend being maybe a little more aggressive is treating them because the redness can be improved with some lasers that treat more of like the little blood vessels that occur there. And also when they're red and new is when we think we can really halt the progress with a retinoid, like retin-A, that kind of
Okay.
thing. Um, I do think that they improve with time, their appearance. When they turn lighter and more of a silvery or more of a skin color, they
Mhm.
tend to get smaller and fade away. And, they're sort of like our war wounds in a way. I mean, I feel like a lot of times we try, you want to be proud of what you did. You had this baby.
Right.
And so it can be a mindset, but I know it's difficult. I mean, I'm not giving the best news because I feel like there's a lot of things that we can't control during pregnancy, a lot of things even beyond just the skin issues, because we want the baby to be safe and we want,
Yeah.
you want you to have a healthy pregnancy.
I think a lot of people who also experience whether it's melasma, oily skin, breakouts, stretch marks, you often, you're in your pregnancy and so you're excited about, of course, growing a healthy baby, having a safe and healthy pregnancy, and then, also looking forward to if you're nearing the end of your pregnancy, like, okay, I can't wait to get back to myself and also feel like myself again, because you get towards the end of your pregnancy and you're just like, I feel so big and like I,
Yeah.
don't recognize myself. Is there, for people who experience things during pregnancy that are totally new, that are, they've never had melasma, they've never had breakouts, and they're experiencing all these things during pregnancy, is there hope for them kind of getting their old skin back again
Yes.
postpartum?
Yes, absolutely. I mean, and many people, cloasma goes away. I do think it's important to say cloasma or melasma, you really want to try to if you're prone to that, like if you have family members or you do notice a little darkening around your cheeks or your upper lip, you really want to stay out of the sun, as you said, really good with your sunscreen, but also try to minimize heat. And heat actually can promote it too. So if you're out there in the sun, but you're in the shade, but it's very hot, try to stay in a cooler environment. That will help to minimize that. And usually when you have a baby then and the hormones go away or they subside, that improves, and all those things like the darkening around your nipple, or even the little linea nigra, the little line that
Right.
comes down from your belly button. Those are all just signs of hormones triggering more melanin production, or more pigment in your skin. So these are all things that can happen. And even your moles can change. Sometimes people will notice more moles coming up, or skin tags, or various little things in the garden that we grow on our skin, that just kind of come up. Also, we didn't talk about spider veins and varicose veins. That is actually something that you can try to prevent, wearing compression hose.
So is that something that's also genetic? Because I didn't really have that during my pregnancy. I was, I had tons of melasma during my pregnancy. I also was constantly staying out of the sun. And even then I was like, bing, like it just like, it would come up. And I had a dermatologist one time say to me, don't do anything for your melasma until you're completely done, 100% done having kids, because it's all going to come back again whenever you're pregnant again, or whenever your hormones change, or if you're breastfeeding. Like, there's so many few things that you can do until you're, done having kids. So that was like, I was like, oh, okay, well, great.
Yeah, we don't have good news for you guys. Sorry.
I know.
Yes, sorry. But yeah, you can do things about varicose veins.
Yeah, but varicose veins and spider veins, I had a lot of friends who experienced that, and sometimes you would see a little, but I remember also hearing that a lot of that had to do with genetic, if that's something that your grandmother experienced, or your mom or an aunt or whatever it is, if that runs in your family, that would also be something that you should experience. But if you're wearing compression socks the duration of your pregnancy, is that a preventative way to have spider veins, or to have varicose veins, especially on your legs, is where they come in?
Well, what's happening really is that your uterus, your womb that's growing, it's pushing on the veins that take the blood back from our legs to our heart. So it's sort of like compressing them, kind of like you might compress like a garden hose, or you build a little dam, maybe like in a river, a stream. And so what happens is that dam kind of causes all the blood to sort of fill up, and all these little tributaries, kind of come up. That's like your little spider veins. So they all kind of fill with blood, and that's why you can get it in your lower extremities. So, the bigger that you get, as you get pregnant, the more this can really push on your veins here that bring blood back to your heart. So that's why we recommend compression hose, to really help to push that, be more efficient at pushing that blood back to the heart, because it's a little harder to get there. Also, you want to try to not stand for long durations. Maybe try to put your feet up so that the blood with gravity can go back to your heart as well. Try not to cross your legs too tightly at the knee. Things like that. Compression hose are, they're great to use, but they're uncomfortable, especially if it's really hot. Especially if it's really hot and you have melasma, and then you're going to put compression hose on and then get even hotter. So all of these things are sort of tied in. And you get swelling in your legs too, because of this compression. And when you have a lot of blood in your lower extremities, sometimes it can cause a little swelling in the area.
My whole thing with compression socks is that I loved the way that they felt when I got them on, but getting compression socks on when you're pregnant and you're large, I was just like, forget it. Like, everybody always said, why don't you ask Chris to just help you I was like, I'm not gonna, I know. I just like, it's a whole thing.
No.
My sister was trying to help. I was just like, it makes you feel like exhausted,
like you can't do, like, why can't you do this? Like, this is not supposed to be difficult. I wish they could invent one that are like pants, like trousers that you put on and you just push a button and it's compressed now, that kind of thing.
Is there a specific time in your pregnancy that you should be wearing them, like from the moment that you find out that you're pregnant, to prevent the spider veins or the varicose veins, or just kind of continually?
If you're prone to this, if you have a genetic predisposition, I would be using it from day one, really. I mean, there are many dermatologists themselves that wear compression hose at work every day.
Oh, wow.
Even if they're not pregnant, or, not thinking about getting pregnant, because that's what happens to a lot of us. even without pregnancy, is your veins just don't get as good at pushing the blood back to your heart. So they get a little bit like there's little valves in there and they get a little flimsy, and so they let like a little blood leak back, and so that's what can really lead to more varicose veins or spider veins.
There were a couple of people who asked about baby acne. Seems like there's so much of that on Instagram. There's a lot of that in just emails that come to you when you first have your baby. I remember with both of my girls, they had like a tiny little bit on their cheeks, and you see so many newborn babies out now that will have a little bit of baby acne on their cheeks. People say, oh, put breast milk on it. That'll make it go away. But can you explain why babies get that baby acne? And is there anything that you can be doing as a parent to kind of help calm that?
I think that initially, like there's neonatal acne, we call it, when the baby's first born and they might have a little acne. And I think that we believe that it has a little to do with, you know, the baby's just left your body and getting a little surge of hormones from you, and sort of now he or she's becoming his own little person.
Right.
And I just think, you know, there's a lot of, sometimes there, you know, acne can be promoted by just sort of like this new skin and this new skin turning over and skin getting clogged, and you're getting like little bumps on it, you know, that sort of thing. There are other kinds of acne that can be, you know, they're a little bit rarer. They're certainly rarer, and they can be bumpy. And, you know, we probably shouldn't even be talking about that because that's just going to scare people. But like, it's not, I didn't mean to do that. I went into another direction here and got all medical on you. But I think that, you know, neonatal acne is very normal, and don't let it concern you. This is not going to continue and progress as this little baby becomes a toddler, or even just a couple months old. It usually resolves. So
I was also told that a lot of that acne and also the hormones that were coming from the mom for breastfeeding also had to do a lot with the baby's skin and how the baby's skin reacts. Like if your hormones all of a sudden are, you know, shifting, especially in your postpartum period, when you're postpartum, your own skin is just a lot of the time adjusting and freaking out in its own way. And so it makes sense that if you're breastfeeding, that your baby's skin would also be reacting to your hormones fluctuating.
Yeah, I mean, I think there's just so many things that happen, and you know, we go through so much. We really need to get a lot more credit for this. I think we get credit for it, but I think that it really, our body goes through so much. And it's such an amazing thing, you know, that, I mean, the hormones there's big surges in them, and there's a big decrease in hormones. That's why also postpartum depression. This is also why, you know, we didn't talk a little bit about hair loss, because that happens to most of us. I don't know if you've noticed that
in pregnancy or postpartum. Postpartum, I definitely, I've talked a lot about. I had like the craziest little bangs coming out the side of my head. So postpartum hair loss for sure, I know a lot about. But during pregnancy, are people experiencing hair loss usually while they're pregnant?
You have more like luxurious growth, really, because again, the hormones sort of promote hair growth. And even sometimes you get growth in areas that you were like, well, I didn't even know I could grow hair there, you know, that sort of thing. But what happens, which is really kind of a nice diagnosis as a dermatologist, when you see somebody after pregnancy and they're really concerned that they're losing a lot of their hair, it's a nice diagnosis in that you can reassure people that it is your hair growing back. When you have those short little hairs that are sticking up, like now all of a sudden you have bangs when you didn't cut bangs, that's because that's your hair growing back. And I think it's actually really fascinating because it's called telogen effluvium, and it's when you have a stressful event like pregnancy. This also happens, like, you know, if you get really sick, if you have a surgery, anything that sort of puts your body into a little distress mode or stress mode. What happens is that kind of prompts your hair. All of our hairs have a cycle of growth, and then it just kind of chills out for a little while, and then there's a death phase where your hair will eventually fall out. A stressful event will trigger your body to have more of your hair cycle through this death phase. So actually it happens during pregnancy or when you have childbirth, when you give a birth, but you actually don't notice the hair loss until like a few months later. So, and that's because the new hair has grown out. The new hair has actually started and it's pushed the other hair out, and now they're short. And so I always reassure people, do you see that when you take a shower, you have all these little hairs that are sticking up?
Yeah.
That's because that's the new hair growing out. So it's a
Oh,
good sign. It's actually a few months later that your hair just starts to grow and really kind of push out and just, so that's why you notice all this hair loss at that time.
that's so interesting. My friends and I always would, whenever anybody has a baby, everybody always sends the little like porcupine hairs, like
Yes.
from a picture below. Everybody's hairs are just sticking straight up in the air. So I'm glad to know that that's actually a good thing
Mm-hmm.
to be seeing your little
Yeah.
bangs. Those are super special. Well, thank you so much. This was to me so fascinating, not only because I'm a huge fan of yours, but also just because pregnancy skincare and postpartum skincare are such wildly interesting
Yes.
times in women's lives. And I feel like we don't talk about it enough,
Mhm.
especially with, your body's changing so much that all of a sudden your skin changes and you're just like, what? I don't even know who this is anymore. So it's reassuring to have all these tips from you, and also a little bit of knowledge knowing that you'll get your old skin back if you
Yeah.
can take care of it along the way.
I mean, it's intimidating. It's scary. There's a lot of things scary about being pregnant. There's a lot of unknown. There's a lot of like, Mom, why didn't you tell me that this was going to
I know.
happen? You don't realize, and you're going to see this through your life too. Like, there's a lot of things that happen in your life because I just sent my kids away to college, and I was like,
Mhm.
Mom, why didn't you tell me it was this hard? And you're
Yeah.
like, because you don't listen, because you're not in that phase yet.
Yeah.
So I think it is important to let people know, and you're doing a wonderful service really in this way to reassure people that it's okay, and to just, I think the important thing is to embrace the happiness of this moment and and how your life is going to change in so many wonderful ways.
Yeah. Thank you so much. This is
Thank
so
you.
exciting for me, and I can't wait to just watch
Yeah.
more videos of yours.
Me too. I can't wait for you to do that either. Thank
Thank
you. Take
you
care,
so
guys.
much.
Thank you, everybody.
Thank you.